Good morning. This hearing is called to order. This is the public hearing of the Joint Committee on Labor and Civil Service and Public Safety. The purpose of this public hearing is to hear testimony on resolution number 200036. Members in the committee in attendance are, to my left, Council members Kenyatta Johnson and Isaiah Thomas. Councilman Curtis Jones, who is the chair of Public Safety, is directly across the hall in our caucus room finishing up a briefing. But we did want to get started for the record, keeping in mind that our law enforcement officials who are present today have some very pressing issues to attend to, so we wanted to make sure we got started as expeditiously as possible. Before we begin, I want to just provide some opening remarks to give some context for my colleagues. Several months ago, one of my friends shared with me an incredible news article about a woman who called 911 to report a domestic violence incident, but she did it under the guise of ordering a pizza. And when the 911 dispatcher, who was a seasoned worker with more than 14 years on the job, answered the call, he initially thought it was the wrong number or even a prank call. But when the woman on the other line insisted and gave her address, the dispatcher realized that it was something more serious going on. The dispatcher began to ask her a series of questions that could be answered yes or no, and she answered with sentences like, "Yep, I need a large pizza," and "No, with pepperoni." When the dispatcher reached out to police about the incident, he told them to turn off their sirens when approaching the apartment. It turns out that the woman called because her mother's boyfriend had come home and begun to physically abuse her mother. The dispatcher said he had never received a call using this kind of coded language before, but he could tell that the woman needed help. This was the story that made me realize not only how stressful the job can be for 911 dispatchers, but also the level of something we don't talk about a lot, and that is emotional intelligence. How much emotional intelligence one must have for this job. The dispatcher in this story couldn't see what was happening, and he could have easily dismissed it, but his institutional knowledge and intuition told him that something wasn't right, and that meant the difference between someone getting help and something much more serious potentially happening. Soon after I heard this story, that's when I learned about the staffing challenges at Philadelphia's 911 call center. Now, I want to emphasize to all who are in attendance that the challenges that we're going to reference, they are not unique to Philadelphia. Recruiting and hiring 911 dispatchers, effectively staffing 911 call centers, and retaining 911 dispatchers has literally been a national problem for the last several decades, and it has only gotten worse in the recent years' tight labor markets. There was a Philadelphia Inquirer article that was published on August 22nd, 2018, that focused specifically not on Philadelphia, but on Montgomery County's 911 call center challenges. And it echoed the fact that counties and states across the nation have, quote unquote, grappled with a dire shortage of 911 call takers and dispatchers, jobs with long hours, high stress, and relatively low pay. Philadelphia's 911 Unified Call Center is not only competing with surrounding counties like Montgomery County for employees, it is also competing with other city employers. As the Inquirer article stated, despite incentives like health insurance, pension enrollment, and partial college tuition enrollment that aim to keep call takers and dispatchers as longtime employees, some people simply don't stick it out. The night shift, it can be tough for people accustomed to a more conventional working schedule, or for people whose families are not able to accommodate the graveyard shift. And some of the call employees, it can be hard. It can be hard, some of the calls that they receive on the psyche. I want to specifically emphasize the chronic stress and anxiety that come with this job and are often people undiagnosed, or untreated for post-traumatic stress disorder, and that can follow. According to the Wall Street Journal, emergency call center jobs can be emotionally taxing. Callers are often in distress and sometimes still in the throes of a traumatic event. They can cry, yell at, or grow frustrated with 911 center employees who are just trying to gather information to help them dispatch the first responders. A 911 center operator may hear gunshots, callers being wounded or killed while they are on the phone, or be the first person to speak with someone who has found a deceased loved one. Some centers offer counseling with local religious leaders or trained therapists, but not all have these services. For my colleagues in 2006, particularly Veterans Council Member Jones and Council Member Johnson, they will remember that in 2006, then Councilman Jim Kenney introduced Resolution 060745 that authorized the city's joint committees on public safety and legislative oversight to hold hearings on whether the city should establish a 311 constituent contact center to unburden the current 911 emergency call center so that we could make Philadelphia more responsive to our citizens' concerns. And while the implementation of 311 has helped to unburden the 911 dispatchers from some non-emergency phone calls, the fact of the matter is that 911 dispatchers remain overworked and underpaid. The city is now facing a situation where many of the 911 dispatchers are feeling overworked, exhausted, and quite frankly unappreciated, to the extent where their physical and mental well-being could potentially negatively impact the cohesion of the unit and the functioning of the call center. Philadelphia is struggling with an increasing homicide rate, is still in the throes of an opioid crisis. And as we know, because we mentioned our law enforcement officials have to leave, we are dealing with a not a drastic, but an increase in the number and preparing for a potential increase in the number of coronavirus patients. Additionally, Pennsylvania is a swiftly aging state. That's going to mean an increase in the number of age and health-related emergencies in years to come. So we called for this hearing today to assess the hiring, staffing, and retention challenges for the 911 call center before we reach a crisis, and to analyze the workplace culture for our 911 dispatchers to ensure that we are supporting their health and well-being. I want to thank both the police and fire departments for their assistance with this hearing. And as I stated when we took our tour, that neither Chairman Jones or I sort of have a gotcha sort of style. And the point of this hearing is not to quote unquote shame or guilt anyone, but to figure out how we can all work together as a cohesive unit to solve these staffing challenges. And for the record, I want to say a special thank you to Councilman Curtis Jones, Chair of the Public Safety Committee, for it was his insight and his arranging a tour of the 911 call center last week so that we could get a first-hand overview of what was taking place at the 911 call center, to see how it was structured. And I want to say thank you to Chairman Jones for your leadership. A special thank you to Frank and to all of the 911 dispatchers who I had the opportunity to meet and to hear your stories firsthand. I now want to recognize Chairman Curtis Jones, who is the Chair of Council's Committee on Public Safety, for some opening remarks.
Thank you, Chairperson Parker. The first thing, I won't reiterate what the chairwoman said, but I'll give you some of my observations. The first thing you have to know is it's located in the roundhouse, and it is actually a round building, which is not designed for this type of activity per se. Some of this stuff will get addressed when the relocation to the new headquarters. But what you also notice when you go into the room is that the lighting is dim, and it's more of a calm place than you would imagine. You would imagine that it was hectic and everything, but these are trained professionals that are designed in your worst moments to be at their best. At your worst moments to be at their best. Because people are hollering, people are excited, people are in danger, people are concern for loved ones, and they have to filter through all of that to get to the facts so they can be of assistance. That's the first thing that I noticed. Second thing that I noticed, Madam Chair, it was a large amount of female operatives there. And I don't know what the correlation to that is. They happen to be minority females that were in that environment. I don't know how that impact happened, but it happened. And that was something that I took notice to. The other thing that was interesting was that the city was divided into sections. Yes. And we, whether it was Northwest, Frankfurt, whether it was West Philadelphia, it was divided in, and so there are different levels of intensity. My 5th district in Roxborough Mania is very different than my 19th district. So how they rotate that kind of activity is something I'd be interested in figuring out. The other thing that I would say is technology. We're hoping that we invest in technology so that people can use the texting system to be able to communicate things in awkward or difficult situations. Texting, if I'm on a bus and someone has a gun or someone is doing something illegal, it is easier to be able, and safer, in real time to be able to text and it go to the real-time crime center or to the dispatch center so that they can render assistance without compromising the individuals trying to be a part of. So these are things that we hope to add to when we get a new commissioner. We think that that's the silver bullet that's going to save all of us. But the reality is, it's more like a picture of a puzzle, and that we have to fix pieces at one at a time. And one of those pieces is the 911 call center. And so we hope that through these hearings that we can put on the record, because we had some off-the-record dialogue, but also at the time of budget, put our money where our mouth is. Thank you, Madam Chair.
Thank you, Chairman Jones. The clerk will now read the title of the resolution being considered today.
Number 200036, a resolution authorizing the Committees on Labor and Civil Service and Public Safety to hold joint hearings regarding hiring, staffing, and retention challenges for the 911 Unified Call Center and the impact these challenges have on the health and well-being of 911 dispatchers.
Will the clerk please call the first panel to testify on the resolution?
Inspector Michael Gillespie and Craig Murphy.
Want to say good morning to each of you, and again just say a special thank you to Inspector Gillespie, Deputy Commissioner Murphy, and all of you who were present during our tour, and just thank you for walking us through very patiently that process just so we could understand how it works. I'll just ask you to state your name and the record, and please proceed with your testimony.
Inspector Michael Gillespie.
Deputy Fire Commissioner Craig Murphy.
Good morning, Chairpersons Parker and Jones and other members of council. My name is Inspector Michael Gillespie, and I'm a commanding officer of the Philadelphia Police Department Communications Division, which covers police radio and our civilian 911 dispatchers and call takers. First, on behalf of Commissioner Danielle Outlaw, thank you for allowing the Philadelphia Police Department to participate in today's hearings. As you know, various topics related to the 911 system are highlighted in resolution number 200036 that touch upon recruiting, hiring, salaries, call volume, 311 call center, staffing, mandatory overtime, retention, etc. So please allow me to provide a brief overview. First, I'll begin with the recruitment process for 911 operators. The City of Philadelphia Central Personnel Department posts test announcements for the police communications dispatcher trainee position approximately every 2 years. Testing is a 3-step process that consists of a written, voice, and typing test. Both the Philadelphia Police Department and the Philadelphia Fire Department hire from the same list. Upon completion of the written test, the applicants are placed in rank order. At a later date, a typing test is given. Applicants who pass the typing test are administered a voice test. After passage of all 3 tests, a list is published for the police and fire departments to hire for the position of police communications dispatcher trainee. An issue that we face with the hiring practice is the city's civil service regulation hiring practice, which includes the Rule of Two regulation, the certification and distribution process of the interview list, and the approval for the position vacancies, make it a constant challenge to reach our current cap of 278 police communication dispatchers. The Rule of Two regulation is that for every approved hiring, we receive 1.5 names. The rule requires that the names appearing sequentially on a certification list are compared to each other during the interview and selection process. This comparison often results in one of the applicants having to be accepted even though they do not meet the requirements for the position. Also, since we are only given 1.5 names for each vacancy, and due to applicants not responding, declining, or not being acceptable, police personnel has to request additional names for the interview for the vacancies. This process usually adds an additional 2 weeks to the already 6 to 8 week timeline. Oftentimes, the established list is already depleted when we make an additional request for names. If this occurs in the middle of the hiring practice, for example, when we need additional names, we then must proceed with the names already interviewed, which results in us starting a class with less than the approved vacancy. To prevent losing the applicants we've already interviewed, we usually decide to proceed with the names we have already interviewed and approved, which results in us hiring less than the number approved to fill the vacancy. The issues mentioned concerning hiring rarely allows us to reach our current cap of 278 police communication dispatchers. As a result, we average a staffing level of 248 police communication dispatchers. Regarding 911 dispatch salaries, in the past we have advocated for the police communication dispatchers to be paid more. We've also noted their duties and associated stress. As a result, the dispatchers receive an additional $1,500 annually. The current salary range for the dispatcher trainees is $35,042 to $38,023. And the current salary range for the dispatchers is $41,930 to $45,869. Call volume is quite high. The 911 center processes approximately 2.4 million calls annually, which in turn equates to 6,486 calls per day. With respect to individual dispatchers and respective call volume, our data shows that on average, depending on the amount of call takers working, each dispatcher assigned to a call-taking position would handle approximately 140 calls per 8-hour shift. The 311 call center handles a number of non-emergency calls that would otherwise add to our call volume. It is important to note that we previously had a differential police response unit that was originally intended to handle lower-level calls of service. Over the years, the number of calls they handled diminished due to district commanders wanting to handle those jobs through their own personnel. This move allowed for more community interaction and to increase the probability of solving those crimes. The dispatchers are distributed amongst 4 platoons, 1, 2, and 3 platoons, which handle the operations of police radio, while 5 platoon handles the external administrative, audio reproduction, training, and the mobile data computers. On any given day, the line platoons are unable to staff the room without the use of overtime, preferably through volunteers, and when all else fails, mandatory overtime. Staffing the room is done based off of statistical data in 4-hour blocks. The highest level is the 3 p.m. to 7 p.m. shift, followed by the 7 p.m. to 11 p.m. shift, and the third highest level is the 11 a.m. to 3 p.m. shift. Philadelphia Police Radio staffing levels are a combination of number of required positions and variable positions. Required positions are dispatch consoles, operations desks, and administrative phone lines. Variable positions are 911 call takers. The number of 911 call takers can be as low as 8 and as high as 33. Minimum service levels established by the Pennsylvania Emergency Management Agency, known as PEMA, require that 911 centers answer 90% of their calls within 10 seconds. This standard is used as a gauge regarding how we are servicing the public. These statistics are audited annually by PEMA. Failure to maintain this service level can jeopardize the city receiving funds generated by this 911 surcharge on phone bills. We consistently average just above or just below 90% of our calls being answered within 10 seconds. In 2018, we averaged 90% of our calls. In 2019, we averaged 89%. PEMA has now mandated that our police communication dispatchers will need to attend 24 hours of training every 2 years and also be trained in CPR. This training will further affect our current staffing levels since dispatchers will not be available to answer dispatch calls for a period of 24 hours per dispatcher. This in turn will create an increase in overtime in order to meet our staffing levels. The minimum number of call takers required to staff 911 phone calls is 8. This is done during the hours of 3 a.m. to 7 p.m. specifically, which is our lowest or slowest 4-hour block of time. In the event that the call-taking room begins to receive more calls than they are able that are available call takers, we rotate dispatchers from the dispatch room into the call-taking room and until the call volume has diminished. And in the event that there is a major problem with our phone system, police radio emergency operation procedures will request that 4 call takers leave the center to staff the backup center, which is in City Hall. Once they are in place, the calls then can be received at the backup center. The remaining call takers will then go to the backup center. The intent is to provide the public with uninterrupted 911 call service. With respect to mandatory overtime, this situation becomes necessary when the volunteer list for overtime has been exhausted. It also becomes necessary after we have made subsequent calls to dispatchers not on the volunteer list. According to District Council 33's contract, we can only mandate dispatchers for a maximum of 4 hours. Mandating personnel does not fully complement our needs since the 4 hours is usually connected to the end of an 8-hour shift. Being mandated or required to work mandatory overtime often brings complaints of fatigue and other factors. These complaints are understandable. However, our data shows that any given dispatcher is only mandated approximately once every 4 weeks. So once a month, the average dispatcher will be required to work a 4-hour mandatory or extended shift. Regarding retention, we lose an average of 3 police communication dispatchers per month due to retirement, promotion, demotion, resignations, and/or terminations. There are often complaints associated with retention, and they involve low morale, mandatory overtime, and other factors. However, it appears that most personnel leave for a non-shift type of assignment, such as permanent day work position. Turning now to the current 911 center facilities, the center received a total upgrade in 2018. With this upgrade, the room was stripped out, cleaned, recarpeted, repainted. The upgrade included new furniture, window treatments, equipment, and software. In the future, the police radio operations will be moving to 400 North Broad Street. Within that space, we are able to expand and redesign the space in order to be more effective and efficient. More positions were added to both the call-taking section and dispatch section with the capability to further expand the call-taking session. This concludes my testimony. At this time, I'd be happy to answer any questions you may have. And I thank you for your time. And if I may, I'd like to introduce Sergeant Joan Little to my left. And also behind me, I also have Chief Inspector Michael Cochran and Captain Ed Appleton to answer any questions that you might have.
Good morning, Chairs Parker, Jones, and members of the Committees on Labor and Civil Service and Public Safety. My name is Craig Murphy, the Deputy Commissioner of the Philadelphia Fire Department, and I am here to speak regarding Resolution Number 200036. First, I would like to thank you for the opportunity to speak on behalf of our Fire Communications Center dispatchers and for your attention to their needs. Today, I am joined by Angel Rodriguez, the Chief Dispatcher in our Communications Center. Our dispatchers are the backbone of our department, and we often refer to them as the first of the first responders. We are only able to put out fires, conduct rescues, and provide emergency medical services because of the dispatchers who come across our radios and tell us where to go and who needs our help. Last week, I spent some time down in the FCC to talk to some of our dispatchers in preparation for this hearing and observed several interactions that made me immensely proud of their work. On one occasion, I overheard a dispatcher walking a caller through the steps of CPR to a loved one for several minutes, helping them count off when to do compressions, all the while updating the caregiver on the status and location of the medic unit. He worked this until the medic unit assumed care. Then he told the caregiver what a great job they had done. Ended that call, and in less than 20 seconds, his screen lit up and he was on to provide assistance to the next citizen in need. This is something that happens daily down in the FCC and highlights the importance and talent of those who choose to serve the city in this way. While the job is incredibly rewarding, over the years, like many public safety call centers throughout the country, we have had issues with recruiting and retaining dispatchers. We currently have 43 dispatchers, 8 supervisors, 1 chief, and 1 deputy chief dispatcher. While the FCC manages thousands of calls daily with the staff that they are often short-staffed and have to rely on overtime and calling in dispatchers on their days off. They currently operate with around 10 personnel on each platoon, but would ideally have at least 13 to keep up with the demand while maintaining a somewhat balanced working environment. The dispatchers work 12-hour shifts and rotate between 24 and 60-hour weeks. Regardless of how busy we are, we always attempt to give everyone 15 to 20-minute breaks throughout their shift to break up the highly demanding and highly stressful job that our dispatchers do. Through our efforts to make this tough job more attractive, the reality is that it is still one of the hardest, most emotionally challenging jobs within city government. Over the last 2 years, we have lost approximately 20 dispatchers and have struggled to find qualified applicants to fill the positions, resulting in low staffing and mandatory overtime. Right now, we have 8 vacancies. We often have to call in people from home to cover shifts, affecting their home lives and taking away the much-needed rest time from our stressful work environment. To help with the demands and stress from the position, we have implemented several interventions to do what we can to help our dispatchers process the tough things they see and hear every day. Just a few months ago, we gave our dispatchers free access to NeuroFlow, a monthly subscription service that promotes positive mental health and stress management practices. Additionally, they have access to the department's Employee Assistance Program, which offers peer counseling and general resources that promote overall wellness. Again, I would like to thank you for your attention to our dispatchers, and I or Angel are happy to answer any questions that you may have.
I want to thank you so very much for your testimony, and I want to acknowledge for the record that committee members to my left, Councilwoman Catherine Gilmore Richardson to my right, Councilwoman Helen Gimmon, I want to thank you both for joining us. Let me just state for the record, Deputy Commissioner Murphy, thank you for responding to our dispatchers as the first of the first responders. That perfectly, to me, captures what it is that they do. Let me just note for the record, when you are walking us through the recruitment and the hiring process, Inspector Gillespie, and this is important for us to get it on the record, as Chairman Jones mentioned in his opening comments, that ultimately for us, we want the data collected today to help us as we work through the city's budget process. You talked about this rule of 2, and as Councilwoman Gilmore Richardson knows from her 10 years as Chief of Staff here in this body, and all of my colleagues, we've talked about the challenge that this civil service ruling relative to the rule of 2 that it has had on the city's ability to attract, hire, and retain employees. Tell us, if you will, because this is the first time, I think, that we will be getting on the record the impact that the rule of 2 is potentially having on the public safety of Philadelphia, as it is hindering the hiring process, that is delaying the process. Explain to us, if you will, for the record, the impact that the rule of two is having on the Philadelphia's ability to hire and retain.
Yes, Councilwoman. If I may, I'd like to turn
Repeat
this
your
over
name.
to Sergeant Little, who is directly involved with our hiring practice, and she'd be the best one to give you that information.
Good morning.
Can you pull the mic close? There you go.
Yes. So what we experience with our hiring practice is, as the inspector testified in his testimony there, when we have, if we have, say, 10 vacancies, what they give us with the rule of two is 1.5 people for those vacancies. So we would get 15 names.
1.5.
Right.
For the record, how do you get 1.5 people?
Right. So, I mean, if you only have one vacancy, they're going to give you 2 names to interview for your selection. We never have that low. So what happens is if we have 10 vacancies, we get 15 names. That equals 1.5 people for that vacancy. So then during the interview and selection process, as those names fall, thank you, as those names fall on the list, that's how we interview them in order. If people fall next to each other on the list, they get compared to each other. And that comparison sometimes holds us up if the person, for our position, they have to go through a background check. So if they fall into a position where they don't necessarily meet are acceptable for our position, we then compare them to the person in front of them and the person behind them, and it causes us a problem in that we have to select one of them, even if they don't meet our requirements.
One of the things that the inspector noted in his testimony is that there's a 3-step process that consists of a written, a voice, and a typing test. So I want to very particularly focus on this. For the written, voice, and typing test, are all of them happening on the same day? And if not, you tell me, in your opinion, is it your professional opinion that they could happen on the same day, thus condensing the amount of time that it takes to get through that 3-step process?
So currently, the way the process works, central personnel schedules a written test on a particular day. And I think they allow about 4 hours for that written test. Some people may take all 4 hours, some people may be able to get done it quicker. And then from that test, the people that pass it are placed on a list. From that list, then central personnel brings them in for a typing test and a voice test on the same day.
Okay.
So the written test is one day, and then the typing and the voice test are at a later date.
Right, and I know several of my colleagues have many questions. I want to ask you this. The issues mentioned concerning hiring, they rarely allow us to reach our current cap of 278 dispatchers. Now, as a result, we have an average at staffing level of about 248. As of today, I want you to tell me, how many dispatchers do you have? I'm not talking about clerical staff and or trainees, but very specifically, how many dispatchers?
Currently, we have 252, but that does include approximately 15 trainees.
So 15 trainees. 15
Yeah.
trainees.
And it also,
Go ahead.
it also includes the administration staff, the people that are in 5 platoon that are dispatchers.
So again, of that 252, you said 15 are trainees, and how many of them approximately are administrative staff?
I think we have approximately, I'll say 18 to 19, but I think I have to confirm that number. Between all of our roles in 5 platoon, we have the administrative staff, we have people that do audio reproductions that are dispatchers, we have trainers that are dispatchers that are assigned to our training unit, and we have staff that also participate in the mobile data computer program.
Okay, so to me, and this is just my dirty math, that was equal to about 218. 218 dispatchers, and you said our current cap is 278.
Correct. So all the other staff that we mentioned in 5 platoon that are administrative and audio reproduction, they don't work in the 911 center on a daily basis. However, they do work in an overtime basis. They are utilized for overtime.
readiness.
Finally, Councilman and Chairman Jones mentioned earlier in his opening remarks that when we toured, we saw a high number of women who were also actually minority women. Do we know the one, and if you don't have it now, that's fine, give us, do you have the demographics for those out of that, again, approximately 218, the dirty math of just the dispatchers, do you know the demographic makeup there?
I don't believe we have that with us today, Council.
Okay, and if you could just forward that to both Chairman Jones and I, that would be greatly appreciated. And we would like to know the number of single mothers, the number of single mothers who are working as dispatchers, and particularly as it relates to the mandatory overtime that is potentially a challenge for the department because we are not at our complement and thus impacts public safety. So we want to make sure we get that on the record. Chair now recognizes Chairman Jones.
So the best ability is availability. In other words, if people are available to work, then that's a good thing. And we want to kind of look at some of the circumstances to deal with that. So we'd like to, in addition, look at some of the time utilization. If people are calling out because they have responsibilities and stuff like that, those are things we can address. That's number one. Number two, what is your overall turnover annually? Meaning, how many people do you lose because of some of these demanding hours, some of the stressors that go with it, and some of the, I have to choose between my child and my job. Those are difficult choices. As we did in our trips to other counties and comparable counties, give me some comparable call centers. And are we paying as much? Do we have as many complements by way of available call responders? How do we manage compared to New York, Baltimore, DC, and other municipalities? Either one of you can take on that.
At this time, I don't have those statisticals
Okay.
or the statistics on that. We do feel that our dispatchers are underpaid and deserve more pay. Right now, at our attrition rate of 3 per month, that would equate to 36 dispatchers a year that we would be losing, but it seems like more. We're consistently working at approximately a 30 dispatcher deficit. Currently, we're 26 dispatchers down.
And when you lose them, do you lose them to other opportunities within the city or the Commonwealth? Have you looked at an exit interview and said, why are you leaving?
Quite a few have taken demotions to other units within the department, which carries a decrease in pay, and they have to note that that's acceptable to them when they do that. Other avenues for them are to go to central personnel to take other tests for other departments. We've recently lost people to L&I, the health department and such. And again, for what I'm seeing there is it's mostly for a non-shift type of work atmosphere. It also carries less stress.
So we have to look at all of those factors and figure out incentives to try to keep your seasoned people, because you have an initial training, but then I would imagine people who are seasoned that have dealt with different levels of calls have different response times for assistance and where they should connect people. That I guess what I'm asking, when do you know you have a A-level employee that you really want to keep there? How long does it take to develop that?
I can just kind of speak from a little bit of personal experience. After a full year, they move up from a trainee to a full dispatcher. And it really depends on the person. Some people, and right after that first year, we know we can use them to train other people. And then there's some that struggle a little more with it, and they take a little longer. So I really think it's an individual thing. I don't think that we can put a timeline on it. Some people are a lot quicker than other people. And I know, as the inspector said, I mean, most of the people there do their best. I mean, all of them, I think, do their best, really. And
I guess what I'm trying to say is there is a capital and time investment that you make into establishing that performance level. And then only to lose it is a actual quantifiable loss to the department. And so we have to figure out how much is that and how much can we incentivize people staying. And that's the spirit of my question. So,
sir, to answer your first question related to their pay as compared to other cities, we don't have the information as compared to other cities, but they make considerably less than Bucks County. And that makes that job more attractive. I don't know, Councilperson, if you had an opportunity to walk through the fire department's fire communication call center, but it's in the basement of fire headquarters. So some of the only opportunity they get to see daylight is when they take their 15 to 20 minutes, just to go take a break or, to take a smoke.
Repeat it.
would you repeat that?
Sure. So our call center is in the basement of fire headquarters, and it's obviously it's a basement, so it's a windowless. So they sit, for the majority of their day in this highly stressful environment, and the only time they get to see whether it's gotten colder, gotten warmer, go out to take a cigarette break, or just go out to stretch their legs is when they come up out the basement for 15 minutes. They can have multiple breaks, but it's still, the environment itself, it's not really conducive to, openness and, just working under those stressors that they work under.
Thank you, Madam Chair.
Just quickly want to ask you, you mentioned, Inspector, in your testimony, you talked about PEMA and rules, this sort of 10-second rule, right, in terms of our answering calls. And Chairman Jones talked about how does Philadelphia compare. I would be thinking in the top 10 big cities, but when you mentioned, when fire mentions Bucks County in terms of regionally, tell me how do we fare in terms of the 5-county regionally? Would you say that in terms of what we are paying and the quote-unquote any incentives that we're offering, that we are at the bottom of the pack? Forget the top 10, but the 5-county, that's Bucks, Chester, Delaware, and Montco. Are we at the bottom of the barrel?
The only that I can answer to right now is what's happening with Bucks County as related to what our starting salaries are for Philadelphia County. I could get that information.
Yeah, if you could just forward to both of the chairs at a later date that information. The chair is now going to recognize Councilwoman Catherine Gilmore Richardson and then Councilwoman Gim. Councilwoman, Councilman Johnson, thank you because you got here super early. Thank you so much. You were super early.
Thank you, Madam Chair. I just had a quick question regarding this work environment and the conditions. So from the union standpoint, it's like a union versus management issue where I'm all pro-union for workers, and so it seems like there should be some type of negotiation and discussion with management regarding the work conditions of the workers that are doing really critical and important work. So can you give me an update or an overview of what that process looks like, or when negotiations is coming up and who the negotiations are with?
Thank you, Inspector. Yeah.
Councilman, we meet regularly with District Council 33, with District Council President Frank Halberth and the associated shop stewards.
And the negotiations with management would be with who?
I'm sorry, sir?
And the negotiations would be with what individual?
At that point, it's collectively between the individuals I just mentioned and the people that are seated with me today. We'll discuss any issues that are current and projecting out. We try to keep each other informed.
So what is the next contract negotiations coming up? This year? Okay. Please keep the members of the Committee on civil service and public safety just aware. Obviously, we're just a support of work and work environment, but the work that you're doing is critically important as public service. This is not a fly-by-night job that these individuals are doing, and so when you're talking about people's lives are in danger, and evil things that happen could be prevented based upon. I remember when I served as a state rep in the House with my colleague, Madam Chair, and I remember meeting with some hospital workers because they were working like doubles and super overtime shifts, and they were talking about how it was having an impact on how they were treating their patients. This was with SEIU, right? And we're talking about some dangerous things happening to patients because you had people being totally overworked, short breaks, right? And so this is a very sensitive issue when it comes to helping individuals, and most importantly, people who are, I believe, are critically important public servants. And so just please keep the committee members just abreast of this process moving forward. Thank you, Madam Chair.
Thank you, Councilman Johnson, and thank you for referencing, Councilman, that, again, the national issue, but statewide issue relative to like mandatory overtime and people who work in positions that call for high levels of stress. Chair recognizes Councilwoman Catherine Gilmore Richardson.
Thank you, Madam Chair, and thank you to both committee chairs and to all of you for being here this afternoon, but particularly to our first responders. Thank you for the work that you do. As Chief of Staff to Councilwoman Blondell Reynolds Brown several years ago, we brought our team to your location at 3rd and Spring Garden, and we visited with the dispatchers in the basement where the old switchboard is. It still lights up occasionally, and we saw the work that you do on a very intimate basis. So I just want to thank all the dispatchers especially for being here. But I wanted to go back to one of your questions relative to the recruitment process, specifically where you talk about both police and fire hiring from the same list. Do you think at any time it would be advantageous to the hiring process to give the police department and the fire department the ability to have and call from separate lists?
No,
Unfortunately, we do not have an opinion on that right now. The numbers that we draw off of that list, and let me back up. Previously, 311 also took dispatchers off our list, and that created a problem. As they're being interviewed by one agency, they're not allowed to be interviewed by the other. So now 311 has their own call-taking agent list or test. And for us in the fire department, we draw a lot more off of that list, so there really isn't that much of a difference for us. So if it stands the way it is, that's fine. If there could be two lists, that would also be fine.
Okay, and Madam Chair, I'll wait until we receive additional testimony to revisit that question again, but I think relative to the recruitment process and dealing with the civil service regulations that we need to look at, particularly around the rule of two and your inability to be able to choose from the list to fill the vacancies that you have, we need to look at how we could potentially split those lists. Thank you so much.
Chair wants to thank Councilwoman Catherine Gilmore Richardson, and just a note for the record, Councilwoman, I did introduce legislation along with several members of council last year to, in essence, look at that rule of two, but I'm sure that each of you, and particularly for the benefit of the public who are watching at home, very complex issue to deal with, because to be quite frank, it's a lot of politics associated with it, and a lot of differing opinions associated with our labor, our union leadership. You can get a perspective, but then as we listen to your testimony here today, which is why, Inspector, I particularly wanted to get it on the record. This is the first time that we have We have heard of the rule of two from the perspective of potentially impacting the public safety of the city of Philadelphia and helping to ensure that you have a very effective, efficient, and expeditious process as it relates to the hiring of the dispatchers that you need to maintain the complement. And so with that in mind, I just want to note for the record, and I know he's going to be on the next panel, but when we hear from Frank at the union, and I know the number I had come up with was with my dirty math, as I call it, was 218, and this was specifically relative to dispatchers and not administration and or trainees. And he's going to give this in his testimony. I'm only mentioning this now because I know some of our officials have to leave, but he notes that by his calculation, there are 69 dispatchers in Squad 1, 70 dispatchers in Squad 2, 67 dispatchers in Squad 3, and then he notes 15 clerical, 23 trainees for a total of 248 employees. But here's the caveat that I want to get on the record. If you're looking at just dispatchers, then we're only at 206. He notes that there are currently 4 dispatchers who are out on family leave, medical, and for a total of 210. He says, so really, and I know it may be a little bit of a dispute relative to the numbers, but before you leave, I wanted to get this on the record. He notes that we really only have 210 dispatchers when we are budgeted for 278 and really need 335. So I was an English teacher, not a math teacher, so y'all just bear with me when I take a little second here. We budgeted for 278. He says we only have 210, so that would leave us with 68 vacancies. And then he says we really need 335. I'm not going to ask any of you to comment or comment on that. What I am going to note for the record, and I appreciate Councilman Johnson noting that collective bargaining, obviously will take place as contracts will expire in June, but we are going to be working extremely hard in order to put these issues on the front burner to ensure that while you're going through that process, that this complement is taken into consideration. Chair right now wants to recognize Councilwoman Gimp.
Thank you very much, Madam Chair. And thank you very much, Inspector Gillespie and Deputy Commissioner Murphy. We really appreciate your support and work and presence today. In a matter of, as both of you have noted, in terms of our dispatchers and being on the front lines at the front lines, in a matter of life and death, I do want to go on the record and say that I support a pay raise. I support a lower workload, and I support, significant measures to make sure that we meet all of the needs of our community, really, and especially in an age of coronavirus, and especially in an age where, we have serious issues about our own staffing and making sure that our own employees are being taken care of and are in a safe place. We know that our 911 dispatchers are incredibly important right now. So that's number one. I appreciate the numbers, but I think one of the more significant ones is that FEMA requires the city of Philadelphia, in order to receive appropriate funding, to meet a threshold of 90% response time under 10 seconds. Is that correct?
That's a industry standard.
Yeah.
And then there's categories beyond that where it's like in 5-second increments.
Right. And then in 2019, we fell below the 90%.
Yes, ma'am.
Okay. And I think that's part of why we're here, is that we are in a situation where whatever, issues we may have around civil service, whatever issues we may have around recruitment, et cetera, that we are now in a situation where we are below what would be considered safety standards for industry in terms of the safety and health and life circumstances of our own residents. Whether or not we agree on the numbers, 210 out of 278 that is budgeted means that we're at 75% capacity. If you were to take 210 out of the 335 that might be recommended, we're at 62% capacity. And so this is a very, very serious issue. And I want you to know that we want to be partners with you on this. I am also incredibly conscious of the difficulties around civil service. So, Madam Chair, I think one of the issues that we've got here is that we are dealing with, our police department and with our unions, but really one of the situations is that, our 911 dispatchers are civilians. We have to talk about civil service. We are dealing with the same thing with the police department and, for example, school safety officers who monitor trafficking and school crossing guards, et cetera, we're also, again, significantly below capacity, even though need is still in existence. It's also a budgeted position, so we're going to need to significantly reframe our conversations about how we're looking at emergency situations, and especially situations where we're significantly below where we need to be, and what it means about civil service guidelines. I just think that that's got to be part of our conversation. I really appreciate, and I know that my council member who has dealt with this for, I'm sure, a little bit longer than I have, understands it. I think one of my questions, though, for Inspector Gillespie has to do with some of the conversations that I think have been hinted at with my colleagues, but also has occurred in my own discussions with your own employees. In situations where we are trying to fill positions and, it's challenging under even normal circumstances, we have a budget and all of that, but I've often felt like the biggest advocates for this position are the individuals who occupy that position. So individuals who are currently in that position who say that, hey, this is like a heroic job, this is a wonderful experience, you should really get involved, it's really great, you can have this, and this kind of qualifications. But I know that in my conversations with a number of the employees, and, wondering what conversations have gone on in the police department, concerns about overtime, concerns about the ways in which a predominantly female, African-American workforce is treated by entities within the police department, in particular supervisors who are not civilians themselves, but are officers. How they're treated has been a big concern. And so has the department reviewed sort of discussions, training manuals, anti-harassment trainings, other types of measures that improves the actual relationship between supervisors there and your 911 dispatchers?
The department goes through regular training, and when we meet with the district council members of DC 33, we discuss things in that nature on a regular basis. We monitor anything of equal opportunity or otherwise discriminatory nature will not be tolerated. In fact, a few individuals have been sent up to Internal Affairs, and Internal Affairs gets involved with investigations. We monitor that. The supervisors there are sworn as opposed to civilian. Part of that is the fact of bringing forth the knowledge of the street and what may be needed out there. If there's any problem that's brought forth, it's dealt with directly.
Yeah. And one of the questions I have is that, is it usually dealt on a one-to-one basis, like there's an individual who has an issue with an individual, as opposed to like a climate-based issue? Because part of one of the things we notice around harassment and especially around gender or anything like that, or race, it's usually not defined solely by a one-to-one kind of situation. It's usually defined by like a structure